to all of you, wherever you're joining us from, for today's Water for Food Global Forum. I'm Crystal Powers. I work for the Doherty Water for Food Global Institute, as well as the Nebraska Water Center here at the University of Nebraska. And I'm really excited for this discussion to kick us off today on the true cost of nitrate. We hope you had time to watch the session that these folks put on that was in our on-demand sessions here during the previous part of the week. If not, no worries, but go catch it afterwards. They did an excellent job walking us through both some of the positive and negative economic impacts from nitrogen and as it turns into nitrate in our environment. I went and looked up, if you're just joining us, went and looked up kind of a definition for true cost accounting, which is kind of where the title of this session came from. And it's a method of accounting for the value of both the positive and the negative economic, environmental, social, and health impacts of any product. And so we're really pleased to have this panel of experts from across these different sectors come together to share both positive and negatives of nitrogen out in the environment. So I wanted to introduce our panel. We've got Don Coulter. He's a professor of pediatrics and director of the Pediatric Cancer Research Group in the Division of Pediatric Hematology Oncology at the University of Nebraska Medical Center. Keith Miller is a civil engineer for the city of Hastings, joining us today. Patricio Grassini is an associate professor in the Department of Agronomy and Horticulture at the University of Nebraska-Lincoln. Mike Archer is with the Nebraska Department of Environment and Energy. Sydney Evans is a science analyst at the Environmental Working Group. And Paul Mathewson, who's a staff scientist at Clean Wisconsin. So with that, we're going to dive into, we're going to start about the first half of this morning with some guided discussion. And then we're going to open it up for your questions or questions from the panel to each other. So be thinking of what you might ask these folks as we jump in. So with that, let's dive in. So my first question to all of you is, you each discussed some specific costs or benefits to nitrogen fertilizer or nitrate as it turns into the environment. What do you see as the trends in the costs in what you spoke about? Do you see those changing as we go into the future, and what's impacting how that is changing over time? I will call on folks just to kind of guide it, unless somebody really wants to jump in and kick us off. All right, well, we'll start in the order you guys went. So Patricio, you want to kick us off this morning?
Sure, why not? Thank you very much, Krista, for the introduction, and thank you for the organizers for the invitation to participate in this panel. It's really a pleasure to be here. And in relation to your question, Krista, about trends in nitrogen in agricultural systems, I'm going to give you here my agronomic perspective. I'm a professor of agronomy. What we have seen over the past 50 years is that farmers have been tangible improvements in the way they use nitrogen for producing crops. An example of that is, for example, corn in the US and in Nebraska. The average rate of nitrogen fertilizer applied to a corn crop now is the same as 30, 40 years ago. That means that farmers have not increased the rate at which their crops get fertilized, but at the same time, the yield have increased substantially. So our farmers have been quite efficient at producing more using the same amount of nitrogen fertilizer. And in doing so, they have been narrowing the balance between what they put on the ground as fertilizer and what gets removed from the soil with the crop harvest. Now, having said that, sometimes it's very difficult to quantify those improvements in terms of environmental outcomes. And one of the reasons is the legacy effect, which means that what you do now in agriculture may have an effect or an impact 20, 30 years down the road. So what you see now in terms of environmental impact may not necessarily reflect what farmers are doing now, but also what they have been doing over the past 60 years. And it takes a little bit of time to really materialize some of the improvements that we have been seeing over the past 50 years. So overall, the trend looks good, but we also have that legacy effect that in many cases doesn't allow us to capture the benefits. And of course, as always, there is things that can be improved, but the overall trajectory is quite good in relation to how farmers are using fertilizer to produce crops.
Thank you, Patricio. That was a great discussion. And let's hear from, all right, I lost my list. Keith, we'll have you go next for this first question.
Hi, my name is Keith Miller. With the city of Hastings, our nitrogen, I guess, address in our drinking water, costs associated really have been addressed through capital improvements. So further capital improvements will drive the cost up as we're seeing, maybe a future need for more than we have. But I guess in utilizing the system we have in place, chemical treatment, there's a little bit of chemical involved. So, that cost seems to be pretty steady, but then the other big user is electricity. So I guess as electricity costs go up, our cost of treatment goes up. But then I guess, as a result of nitrates, we're going to be maybe seeing some potential other contaminants come into the system due to the biological mechanism taking place. So we have to watch for uranium. But I guess as far as future costs go, hopefully kind of what we see now as our, I guess, annual operating costs kind of will remain the same.
Very good. Mike, you want to jump in with thoughts in our lakes and streams?
Absolutely. Thank you. Thank you for having me here. Yeah, the costs that would be associated as far as our lakes and streams go is really coming down a lot of times to renovation of those reservoirs and lakes. And that goes to what Patricio was saying about those legacy nutrients, and that we've got reservoirs that have 50 or 60 years worth of sediment and nutrients built up in them, and that comes with a cost to remove those that sediment and those nutrients, and that cost is not going down. There's a lot involved with that. It's a labor intensive process, and obviously labor costs are not going down, and equipment and fuel and all of that stuff is all going to continue to rise.
Very good, thank you. And John, can you speak a little bit about the medical costs?
Yeah, no, thank you so much for having me, and I appreciate being able to speak with this panel. I completely agree with what Patricio was saying about farmers and the efficiency that farmers have utilized to maintain the same yields with sort of the amount of nitrogen they've been using. The same call can be made to the medical community in the way that we need to increase the efficiency to maintain cost control in the way that we take care of patients. And so in sort of the nitrate question, to me, what's really important about this, and one of the positive parts about having this discussion, is even if we're looking at nitrogen and nitrates as a possible cause of certain diseases in pediatric patients or adult patients, it also frames a broader discussion of understanding how are we going to take care of this population over time, and what efficiencies can we build into the medical system in sort of maintaining these people to be able to have their lives, be able to be in rural areas without having to come to the urban areas for care, whether that's telemedicine, better education of medical professionals who are working in rural communities, thinking about different ways of administering care. I think over time, those costs need to be better managed in the medical system in the same way that farmers have managed their costs in getting the same yields for the nitrogen that they're using.
Very good, thank you. And Sydney, you want to weigh in with your thoughts?
Yeah, absolutely. So there was a piece in our paper talking about time trends of nitrate concentrations. I'm going to let Paul talk about that since he's more well-versed on that piece, but I can add that EWG did an additional report last year looking at nitrate trends across 10 states. And it showed that the contamination in the worst areas is growing steadily worse. And that was over the course of 15 years worth of water data. And so we need to consider that when we have increasing nitrate concentrations in water, we saw through our research linked to increased health risks, especially for birth outcomes. So without any intervention, if the nitrate concentrations continue to rise, so will the health impacts and so will the health costs.
Thank you, Sydney. And Paul, go ahead and add on to her thoughts.
Yeah. And so the framework we were looking at costs was relating exposure in terms of concentration in the drinking water to increase risk to adverse outcomes due to the different exposure. And so when I'm thinking about this question, I'm thinking about, is there evidence that the levels in the drinking water are going up or down in Wisconsin? And so in our paper, one data point we have is there's a whole system of we call non-transient wells here in Wisconsin. Basically, they're wells, they're not municipal supply wells, but they're wells that serve at least 25 people, at least 60 days a year. There's things like, at a bar or a restaurant or a hotel, they have their own well. And so they're required to test for nitrates every year. So we have this data set in Wisconsin where we can look across, in our paper, we looked at wells that are in service at least 10 years within the past 20 years. And we looked at trends, and across the state, most of the wells were no change. 76% of the wells, there's really no change over the past 20 years. 14% are increasing, 10% are decreasing. So of those that are changing, more are increasing in concentration than are decreasing, which would suggest that the groundwater overall is getting worse in terms of nitrate levels. When we just look at the sections of the state where it's more rural, more agricultural, that the number of wells that are increasing goes up to 20%. So in these areas, we're seeing this signal that the groundwater is getting worse. Now, whether that's due to, I'm sure it's a combination of legacy contamination, as Patricio had mentioned, had alluded to, and also the ongoing application of nitrogen and nutrients to the fields going on. So that's one data point that we have in Wisconsin suggesting that costs are going to continue to increase, at least in the near-term future. Another data point that we have is our Department of Agricultural Trade and Consumer Protection. They do some targeted sampling every now and again of private wells in areas thought to be susceptible to contamination from agricultural chemicals. So places where you have intense agriculture or places where the soil is vulnerable to groundwater leaching. And so they just released a report comparing sampling in 2015 to sampling in 2020 of these 72 or 79 wells that they targeted of private wells. And in there, 51% of those wells, the nitrates were increasing. Some of them increased by over 10 parts per million in that time period. So again, another signal that at least in Wisconsin is, people are going to get exposed to more and more nitrates in the coming future, and thus the medical costs associated with that would be expected to increase. On the flip side, in Wisconsin, we do also have farmland that's being sold off, taken out of production, sold off into subdivisions. And there was a recent paper that looked at nitrate trends in a subdivision, and they did find that it went down relatively quickly. Within 10 years, they're able to see a significant decline in nitrate concentrations after it was taken out of production and converted to subdivision. So, overall in the state of Wisconsin, it's going to be a balance. How much of that farmland is taken out of production is probably not going to be a whole lot, compared to what continues to increase. But I would say overall, we're expecting to see increase, at least in the near term.
Very good. And so a follow-up question for each of you, and maybe we'll go in the same order to give you each some time to think, similar amount of time to think. And next time I'll maybe reverse the order just to be fair to everyone. But when you think about your particular sector, who's paying for those costs and who's receiving the benefits within your particular sector that you're talking about? So let's kick off with Patricio again.
Yeah, thank you, Krista. This is a very exciting conversation. In terms of, well, again, I'm going to narrow down here to what I know about, which is the cropping system level. And I guess that farmers are both the ones who benefit and also get hurt when applying fertilizer, because if they apply a fertilizer in a way in which basically what they apply helps the crop to meet their nutrient requirements, and by doing so, the farmer obtains a high and profitable crop, then the farmer will benefit from that. Now, if a farmer over-apply nitrogen, and which leads to environmental impact, that farmer gets hurt by an inefficient use of fertilizer. So the idea that farmers are benefiting by over-applying nitrogen is not accurate, in the sense that the best farmers that I know, the ones that make more money, are also the ones that are the most efficient in the use of fertilizer. So again, that can go both ways for farmers. They will benefit from nitrogen, but also if they are inefficient, they will their economics are going to get hard, and also the environmental impact is going to be high. And that's why I say in my presentation that there is really no trade-off between farm economics and environmental pollution, in the sense that when farmers are losing nitrogen, they're losing money. And that needs to be clear. There is no trade-off there between applying fertilizer, make money, and trying to mitigate the environmental impact. Thank you.
Thank you, Patricio. How about, where's my order? Keith, what are your thoughts on this question?
On a local scale, the ratepayers of the city of Hastings would be the ultimate funding for our project. But I think I also spoke to some of the other programs that received funding from, the 2 NRD watersheds that we fall into. So that would probably that's tax-based money from people throughout the NRD there. And then there's also been the NET grant, and then another, I think a clean water grant also that came from the state of Nebraska. So I'd assume that's probably tax dollars coming to the city of Hastings for our water cleanup. But then, for the most part of the roughly $16 million we've spent, I would say over 12 million of that's going to be then funded by the city of Hastings, which is just reflects into the water use rates. And then, so I guess those are the people also benefiting to the cleanup of the water. But then if you think about who's benefiting from the application of nitrates that we are having to clean up, then it starts to get to be a slippery slope real fast. Obviously, it's the producers in the area, but it's not only the producer, it's also the whole chain of who's making money off of that grain. So whether it's the co-op, whether it's the seed sales, the chemical sales, the ethanol plant, the meat packing industry, and then it's just getting shipped around the world. So that money chain, I guess, stems out pretty quickly.
Very interesting. Thanks, Keith. And Mike, what are your thoughts on this?
Sure. So, I have to look at this in a couple different ways. Locally, as we talk about Nebraska, basically, as an agency, we work with producers in various watersheds to try to implement best management practices. And with that implementation, it's often a cost share sort of deal. So we'll offer, a percentage of the cost and work with the local NRD to offer a percentage of the cost, and then the landowner would bear a portion of that as well. And, on the premise that we all win, right? If we can improve their efficiency and lower their input costs and keep that nitrogen out of the water, everybody wins. So on that level is really who's paying those costs, and that the money we offer is obviously Clean Water Act money, which is provided through the EPA and through that mechanism. But when you talk nationally, the cost becomes quite higher, and the pay then goes on to the taxpayer, because Nebraska doesn't have a lot of surface water drinking sources, right? All of our water is provided, almost all of our water is provided through groundwater, but that's not the case throughout the nation. And a lot of cities, a lot of areas are relying on surface water for their drinking water source. And to treat harmful algal bloom caused by excess nutrients is expensive, and that is a cost that bears out through everybody that's using that. I don't have a rough number, those are available, but it's expensive, and it's always, with everything, prevention is always much cheaper to deal with than to try to repair it after it's done.
Very good. Thanks, Mike. And maybe to, I realized we were using an acronym that those outside of Nebraska, and maybe even people here in Nebraska haven't heard of, is NRD. And in Nebraska, that's a natural resource district. It's a local governmental agency that ours are based on watersheds. We have 23 in the state, and their funding is based on local taxpayer dollars to do their programs, and they're tasked with ensuring clean water and other natural resources. So just for those of you who haven't heard that before, that's what both Keith and Mike were referring to, is a lot of this work comes through our natural resource districts. Thanks.
Thank you, Crystal. I sometimes assume that everyone knows what I'm talking about.
Yes. Well, we all love our acronyms, don't we? All right, Don, what are your thoughts on this question?
Well, I think I have to preface my comments with the idea that we don't necessarily know what causes pediatric cancer, which is my specialty and my sort of focus area. And when you're talking about costs, we're making a big leap to say that some of the pediatric cancer that is in Nebraska could conceivably be caused by the quality of our water supply, whether that's because of nitrogen, uranium, other heavy metals, or agrochemicals. So all of that being said, that we don't know necessarily whether that's true or not, we do have this increased incidence in Nebraska of the 7th highest incidence in the country of pediatric cancer without completely understanding why. So if we say that it's due to water quality, who pays that cost? Well, number one, it's obviously the children who are dealing with the disease, the toxicities that comes with the therapy for it. It also then impacts the rest of their life, because even though we have children who survive the disease, 75% of them will go on to have long-term impacts from the care that they received that will require medical attention for the rest of their life. Who else pays that cost? The parents, in many different ways. First of all, obviously the horror of dealing with a child who has cancer, but in that, the logistics of it, we know that there are many, many costs that are passed on to the family, whether that be the idea of can they stay employed because they have to take so much time off to care for their child both in and outside of the hospital, travel costs that can be impacted more in rural areas for people who have to travel such a great distance. So if we say that water quality is having a hand in diseases like cancer or birth defects, the cost is going on to the family. And in some way, that cost is then going on to all of us, because there's a lot of us who pay taxes that are going to benefit sort of the healthcare of these people. So in the system itself, those costs are all passed on to us. Now, there was some research that I cited in my presentation of adult cancers that we know are caused by nitrogen, specifically things like stomach cancer and colon cancer. And the idea was that the amount of money that's being paid out by the medical system to nitrogen-caused cancers in the United States is in the billions of dollars. So there is a healthcare cost that's being paid off. Who benefits if we can address these issues? Well, again, like I said, I think the discussion of nitrogen leads us into better discussions of the quality of the healthcare that we provide to a rural population. And in that regard, not only can Nebraska benefit and the system of Nebraska can benefit, but anything that we design within our state can be replicated to other states that have to take care of a rural population, or other states that have agriculture as a main base of what they do. And so the systems that we design to address these issues here in the way that we can effectively care for this population can then benefit not only us, but other places in the United States and quite frankly in the world.
Very good. Thank you, Don. And Sydney, would you like to share?
Yeah, that was fantastic. I don't know how to follow up with that, but I guess I could add a little. So when it comes to discussing contamination or setting regulations or policies, or even just changing practices, the discussion always comes down to cost benefit. And it's much easier to come up with figures for additional treatment at a water treatment plant, or cost to businesses or farms for prevention measures. But I feel like that downstream cost of the health impacts, like Don was saying, it's missed because it's harder to quantify. It's spread across many individuals instead of just impacting one entity with financial records even. And those impacts are harder to relate directly back to the water contamination. So that was the motivation for the study that Paul and I did, was to try and bridge that gap between what we know academically from research about health risks, and then what we can do to advance policy discussions and paint this fuller, fairer picture of the costs overall, because it's not just cost to the treatment plant or cost to the businesses, cost to the farms, there's also this health impact and all of those other peripheral impacts as well that really need to be taken into account to be fair.
Thank you, Sydney. That's a great addition. Paul.
Yeah, and Don and Sydney did a great job talking about all the, the cost to the health impacts of it. So I don't have anything more to add to that. They're excellent points on that. If I can just speak more broadly to, the way we see this, the cost benefit stuff of nitrate, on the plus side of nitrates, as Patricio was mentioning, it's been great in terms of being able to produce abundant, nutritious food for the population and at a fairly cheap price here in the United States. And so, that benefits a lot of people to be able to have food at that price, ignoring the externalities of it. So we do have to, account for those externalities, which is this is a great panel about that. And also how it's been able to support, farmers. I understand, I know this isn't my area of expertise, but I'm peripherally understanding that, they're the foundations of rural communities who aren't necessarily, there's struggles in those communities now, and having this nitrates and be able to have a profitable farm is important to maintaining the rural communities in Wisconsin and throughout the United States. So there are definitely pros to using this, but we just got to figure out ways to use it appropriately to minimize these externalities or hopefully eliminate them. And in terms of paying costs, like I said, Sydney and Don spoke really well about to the health side of things. So more practically here in Wisconsin, since a third of our population is getting our water from private drinking wells, mostly in rural areas, mostly rural agricultural areas. So there's a lot of personal cost associated with mentally worrying about your water quality. And then also, once you have a problem, it's on you to either dig a new well or install treatment. And so that's not cheap. And then, also having to buy, test regularly to make sure your water is still good and maintain all that. And so, those are costs that we all, when we're advocating for nitrogen policies, we want to make sure those are included in the conversation about, making, the individuals having to do all this on their own and have to think about it, have to put out the money to do that. And we try to get resources, we advocate for resources for people to, be able to do that because it's not expensive. Here in Wisconsin, like the average cost to dig a new well, I think they're saying it's like $12,000. And so, that's out of reach for a lot of people. And then to put in a whole system, whole house reverse osmosis, you're talking $5,000-$10,000 as well on that. To be able to make sure you got clean water everywhere in your house. So, those are other costs that we think about as well.
Great discussion. I'm going to ask one more question in this section, and we're getting some great questions coming in the Q&A. So for those of you listening in, please do keep adding those typing them into the Q&A box, and we'll get to those after this last round of questions. And just to keep it exciting, I'm going to go reverse order. So we'll put you up next, first this time, Paul. So what are some strategic investments that would improve the outcomes in the sectors you work with? Where, and not saying it another way, where can we get the biggest bang for our buck?
Yeah. So I don't really know about, on the farm, on the field stuff, and which is, hopefully Patricio or others can speak to that. I think, that's a big piece of it. But one main thing that we work towards, and I kind of alluded to it, was just trying to increase awareness in terms of minimizing and addressing the public health consequences of it. What we're working towards is greater awareness of the problem, and because nitrates and other agricultural chemicals, you don't see them, you don't taste them, you don't smell them in your water, so you don't know that they're there. So we want to make sure that people are aware of the risk and taking appropriate measures if their water is contaminated to avoid those costs, especially for pregnant young families who are planning to have kids. And so that prenatal exposure is super important there. So you want to make sure we get that information out there, and then to also provide resources to folks where there are problems. Like I know we have a well compensation fund here in Wisconsin, where if they're contaminated by certain agricultural practices, you can get some subsidized subsidies for installing a new well or getting treatment. So we want to make sure that that's appropriately funded to deal with the scope of the problem here in Wisconsin. So those are my thoughts on that. But I mean, I'm curious to hear from others about on the field where, where can we start making some changes.
Very good. Thanks, Paul. Sydney.
Yeah, so I'm really glad this was asked actually, because it wasn't something I talked about in our talk, but just recently, like a couple weeks ago, EWG published a paper. We were coming up with a method for basically like a screening tool, and it was for the question of equity in water quality. And what we did was use publicly available data. So the system overlap area with census tracts, the census data at the census tract level, and then the water quality data that we have as part of the EWG tap water database. And what we wanted to do was develop this method that could be used by anybody to look at disproportionate impacts. And so I think that a tool like that, or a method like that, using some sort of screening to incorporate not only the the how bad the water quality is, but also who it's affecting, is a really great way to try and target policy and intervention to the communities that need it most, to get the biggest payoff and protect the most people.
Very interesting. Thanks, Sydney. Next up, I gotta look at my list to go reverse. Don, he's already unmuted. He knows.
Yeah, I think Sydney brought up a really great point about trying to identify which communities are most at risk and most impacted by these issues. And again, I'm going to go ahead and make an assumption that I probably shouldn't make, but I think that we can feel relatively safe saying that rural communities as a whole are probably impacted by these issues more so than urban communities, not only because of community well water, but also because that's where we're actually having fertilizers and agrochemicals and different things applied to the soil. So in that regard, what are ways that we can sort of try to alleviate that push on rural communities? I think one of them is telehealth. And telehealth has been something that we've talked about for a long period of time. And then when the COVID pandemic hit, we were forced to really try to implement telehealth in a way that would allow everybody to safely be evaluated. We still haven't, I don't think, solved this issue. And I think telehealth can be utilized to alleviate some of the impact on these rural places that need to get subspecialty care. So in pediatrics, as in Nebraska as an example, if you have a pediatric issue, whatever it may be, and you need a pediatric subspecialist, whether it's a gastroenterologist, an oncologist, or a cardiologist, the vast majority of those people practice in urban areas, which is Omaha in Nebraska. In any other state or locality, you're going to see relatively the same thing, that these subspecialists, not only for pediatric or adult problems, are located in the urban centers. The rural centers are left out of that ability to see that subspecialty care in most instances. And so because of that, telehealth becomes a way that we can alleviate these issues. I think the dream of telehealth has been, I can sit in my home and I can have an interaction with a physician that's going to answer all of my questions. That might not be the best way to implement this. We might need to utilize some of the community colleges or centers that are available to certain rural areas to allow people to go to a place where some of their vital signs and different things can be evaluated, and then they can have a telehealth visit that alleviates a lot of that travel. But we have the capability of thinking through these issues and using nitrate and water quality as a way of having that discussion. I think that's a discussion that needs to come to help with the efficiency of caring for people who are impacted by these things, both in a pediatric way and an adult medicine way.
Very good. Thanks, Don. And Mike.
I'm going to be honest, I don't know if I have a lot to add that hasn't already been said. So I will go ahead and pass.
Yep, no, perfectly fine. Keith, any thoughts on this question?
I guess when you talk about biggest bang for the buck, probably for a community, mainly it's setting up your wildlife protection area, which then, gives you tools and resources for nitrogen application control, proper well siting, proper well abandonment, and just better management practices, and hopefully, just result in controlling the contamination at the source. And then I guess on the treatment side of things, I'll just speak to that, improve on your efficiency. So, Hastings, we didn't go full scale treatment. We went 2/3 treatment, use the aquifer as still our friend. So that's our storage. But then I guess when we look at treating, we want to treat, if we can focus on specifically dirty water for treatment. So we have, we are able to skim skim the water out of our wells to get separation. That just, reduces our volume, reduces how much we have to treat. So that would just be some of the, I guess, biggest takeaways from that.
Thanks, Keith. And Patricio, thoughts on the farm level?
Yeah, very exciting, Chris, when we need to think about how to put a solution agenda together, to solve this issue. So something that to me is important to consider here is, how we prioritize things, especially, I mean, from an spatial perspective, but also from a farm population perspective. And I'm saying that because if you really look at the overall nitrogen load from agriculture in the States, and you see where it comes from, you will find out that probably there are about 15–20% of the current area that account for the largest portion of the whole nitrogen load, which really help us to narrow down, where we should prioritize programs and policy to solve the issue. And even further, if you go to those areas and you take a look at the distribution of farmers and you look at, for example, what's the nitrogen balance at their fields, you will realize that probably most of the end load from that population of farmers come from 20–25% of farmers that are clearly applying too much nitrogen in relation to what they should be applying. So again, if we put the two things together, the spatial framework together with an idea about how the population of farmers looks in relation to nitrogen inputs, nitrogen balance, then you have a very clear pathway about where to go if you really want to solve this problem in a cost-effective way. Now, one more thing, timing is also very important. And I want to remind you and all the people that are listening to us that right now, the fertilizer price is at the sky. It's the highest in many decades. So now is the perfect time to go out there, talk to farmers, and show them that that how much money they can save, how much more profit they can make by making a rational decision about how much fertilizer they should be applying there, depending on the current price. So sometimes, periods of times with low commodity price or with high fertilizer price are the right ones to try to, translate this message to farmers.
Yeah, I would agree. I think timing is great now to talk about how efficiencies in fertilizer can really be realized. Very good. Well, we're going to go through, I know I heard you guys touch on some of the questions that have been submitted so far. But I'm just going to go down kind of in the order we received them. And then after we do this initial round, if you've got questions for each other as well, we can do that. So I think the first question is mostly for Patricio. It asks, is the nitrogen, well, it asks nitrogen uptake, but I think it's nitrogen efficiency. It's probably what they're getting at. Different between irrigated fields and rain-fed fields. And how does soil type also affect it?
Yeah, that's a very good question. The nitrogen use efficiency, what we found is, if you compare, for example, irrigated corn in Nebraska versus the rain-fed corn in Iowa, the efficiency tends to be higher for irrigated corn in Nebraska, even though the application may be a little bit higher. But the reason is because when you have irrigation, the expected yield is quite constant over a year, so you don't depend too much upon weather. So if you know that your yield goal is going to be pretty stable, then you pretty much know how much nitrogen you should be, and you will be pretty much close to what you would expect. In contrast, when you are in rainfall conditions, basically it really depends upon the sky. If it rains and you put too little nitrogen, maybe you run short. If you put too much and then it doesn't rain, then there is a large surplus. So that's why typically what we found is that in irrigated systems, the efficiency tends to be a little bit higher than in rain-fed systems. And again, it's not related with the amount of fertilizer, but rather, the balance between what you apply and what you extract with the grain. And then the other question was related with the soil type. And yes, all our research shows that from a biophysical perspective, there should be no difference in nitrogen use efficiency depending upon soil type, but there is a risk component there that is very important. In sandy soils, with good management of the nitrogen in terms of splits, timing, and sources, you should be able to achieve the same efficiency as in any other soil type. However, there is always this risk perception from farmers that, in sandy soils, you're always running short, you have more leaching, you have more losses, and therefore you always have to over apply, which overall is like a circle in which they go and they will end up applying more nitrogen than really needed. So what we found in our data, looking across thousands of farmer fields in Nebraska, is that typically the N surplus, the N excess, tends to be much larger in sandy soils compared with soils with finer soil textures. But again, this is, let's look at the bright side. This means that if that's true, then our extension and research programs in our policy should try to target corn farmers growing corn in sandy soils and try to help them to make a more efficient use of nitrogen, because probably it's in those sandy soils where they are the largest potential gains in terms of reducing the associated environmental impact. So, so again, there is a bad side, but also there is a bright side in terms of an opportunity to implement good policy and programs to mitigate the problem.
Thank you, Patricio. The next question is for Paul. And if somebody else wants to jump in on these others, just interrupt me. But the next question is for Paul. What has been the reaction from stakeholders to your health and economic impact of nitrate report in Wisconsin? Is it being utilized in any policy development in the state?
Yeah, so it is being utilized in policy development. Right now, there's some rulemaking at the Department of Natural Resources to implement some targeted performance standards for nutrient application and management in areas of the state vulnerable to groundwater contamination. And so as part of that process, they have to do an economic impact analysis of the proposed rules. And our study is the main point that the DNR pointed to in terms of the benefits of taking action. I would say probably the discussion is still dominated by the impact that it will have on the farmers in terms of cost of compliance, getting nutrient management plans, lost productivity, and all that. But at least has been injected there. As Sydney mentioned, all too often these discussions are just pretty much one-sided because the costs are hard to quantify. But to be able to have this data point, this estimate here in Wisconsin has been injected into our policy discussions, and it's ongoing right now. Hopefully it'll help get these rules pushed over the line.
Thanks, Paul. And I didn't know, Sydney, did you have anything you wanted to add to that discussion?
Not specifically,
Okay,
no.
sure. All right, and I think our next question, we'll start with Keith and others can jump in. The question's asked is, could drainage systems, surface or subsurface, pump the top, or I think it's skim the top of the high concentrate nitrate water coming into the aquifer, which I think is a little bit of how your system works, Keith. Like I said, and others can jump into.
I guess I'm not sure on the drainage system. To me, that's surface water. So at that point, you're not going to get any separation. So there shouldn't be any skimming. You're just going to have, pretty uniform mixing. But whether that's at the surface or subsurface, I mean, our watershed's 76 square miles. So it's hard for us to put a point finger as to here's the exact locations where we're seeing deep percolation. That's going to vary from year to year, month to month, or even day to day. It's not like a consistent, a good time for targeting to collect that deep perk. And then again, how do you do that? Being subsurface. I guess if there's any other follow-up question to that, I can try to address it.
I didn't know, have any of you worked with, maybe they're talking about tile drainage systems and capturing it there, which I think is more common in Iowa and states east of here.
I would add, and I'm not an expert on this, but when we work to implement BMPs on within watersheds, one of the things that's coming out that we're seeing a little more use of, and I'd love to see more of it, is denitrifying bioreactors, and that maybe is sort of could address that drain tile. And these are pits that are put on the edge of a field where the drain tile is routed to. They have basically wood chips in them, and they cover them up. The wood chips allow bacteria to grow on them, and when the water flows through there, it denitrifies a percentage of that water going through there. So there is, some methods out there to deal with that.
Yeah, and I think both of you highlighted it's much different how we treat surface water runoff versus what's being deep percolated into our aquifers. The solutions are probably much different in each of those. The next question is for Don. Are nitrate-related deaths affecting poor or rich communities?
That's a good question. There's a lot of efforts that are going into understanding the socioeconomic difference in pediatric cancer. And specifically, we know that certain socioeconomic groups don't enjoy the same overall survival that other socioeconomic groups do, specifically if there's pressure on the families to try to be adherent to the therapy. And those pressures are obviously felt more by people in a different socioeconomic group. As it relates to nitrogen, the studies that I'm aware of have really sort of focused on the Hispanic population, and that the Hispanic population and Hispanic communities are impacted more by nitrate contamination in the drinking water and the very specific things that we think are truly caused by nitrate in water, meaning conditions like methemoglobinemia or neural tube defects, which lead to birth defects, or thyroid cancer, or colorectal cancer. So the short answer to the question is yes, there are socioeconomic groups that are impacted more by the mortality from nitrate. And in the specific setting of nitrate, it would be the Hispanic socioeconomic group, but also we know that there are social determinants of health that are at play in all of our diseases in the United States.
Thanks, Don. And I'm going to toss this question out because I'm not sure who might want to weigh in. It says, as we move towards electric vehicles and expect more than 50% of gasoline vehicles to move to electric by 2040, there will be a huge reduction in corn ethanol use in fuel. What are the options for producers? And maybe I'll add with a shifting market, because that's talking about, so there'll be less demand for corn in the future, which might affect corn pricing. What are options as we look towards those sort of shifting markets?
Maybe I can take that one. But before answering this question, let me make a comment, Crystal, about the question about the removing nitrates from groundwater.
Mm-hmm.
Here in Nebraska, we don't have that much tile drainage, but we do have about 50% of our corn soybean area is under irrigation, which means that basically we are irrigating with the water from the aquifer, which also has all the nitrates that have been leached over time. So in a way, we are kind of recycling the nitrates through the system. So along those lines, in a way, by irrigating, farmers are helping to clean up a little bit the nitrate from that system. But to do so and be effective in doing so, they also need to credit it. They need to credit for the nitrogen that comes from the aquifer, which in many cases do not happen. So there is a kind of a very practical agronomic way to clean up the water from the aquifer, if you want to call it that way, by crediting the nitrogen that comes from irrigation water when farmers irrigate. Okay, so that's on the previous question. Now in your question about if you really want to push to the limit here, we may want to say, let's change our diets. Let's all become vegetarians, and then we don't need more corn because we don't need to feed our livestock. When I hear, and the same applies to corn ethanol and to many other things, and for sure there is nothing wrong in trying to do that and in proposing those things. Always my concern is what's the timeline for those things to happen, and because in the case, for example, of changing diets, things like that, those are things that takes usually generations, to happen. And therefore, while those things may happen one day, it may take some time. And also, corn, let's also be more, let's have a more broader view here about corn demand. Yes, it is true that a lot of our corn now is being used for ethanol, but corn can be used for so many things, for so many different uses. And let's also look at this from a much global perspective. The demand for corn globally is going to increase in places like Southeast Asia, East Asia. The demand for corn for feeding livestock is going to the sky. So to be honest, what may happen or not may happen here in the States in terms of change in energy sources or change in diets from a global perspective in terms of the global corn demand may not have that much impact.
Thank you, Patricio. And then we had a question asking for the link to the 10-state study from Environmental Working Group, and Sydney did provide that. So we'll make sure that that resource is available, and we'll have other follow-up resources after the session. So the next question is, let me read. I think it's another ag. Wow. Says, I work for an organization that is overseen by a board of directors, most of whom are in ag production. How do we get them to understand that nitrate contamination is a health concern? They feel that it is not a concern, and even the 10 part per million limit is a fake number.
Can I take just a preliminary shot at that, Crystal?
Sure, go ahead.
I want to give a little bit of positive hope that I do think that there are certain companies and the state legislature of Nebraska that are looking at this as a true problem and trying to address it. I can agree with people who say that the 10 part per million number may not be the right number. And that's a completely different discussion as what is the allowable level of nitrate in our water supply. And should we be looking at just the isolation of nitrate alone, or should we be looking at nitrate with other compounds? Keith had talked about uranium. And so is it just nitrate alone, or is it nitrate when uranium or arsenic or others are around? I was approached by a company that is probably the world's largest producer of central pivot irrigators to talk to them about nitrate and pediatric cancer within the state of Nebraska, because they were interested in sort of thinking about that problem. And as I've said, I've been fortunate to talk to a number of senators about this issue. You had mentioned that we have our NRDs, and a number of the NRDs are beginning to really critically look at this. So I have actually some hope that this is going to become a much more common discussion, and finding ways for states, companies, communities to address these issues is going to be in the forefront of those discussions.
Very good.
Weigh in on that
That's
as well.
exciting.
Yeah, so I think important in these discussions is understanding for people that, go based on that 10 ppm number because that's what's legal. It's important to kind of lay out where that number comes from and showing the difference between what is legal and what is safe, because those are not very commonly the same thing. So that 10 ppm number was set, I think, in the 60s based on the blue baby syndrome. But we now know we have decades of research that shows other health effects at lower limits. So I think that is a good place to start, not trying to debate what the magic number is for what should be legal, but showing that we know that there are decades worth of health studies that show that there are risks of different kinds at lower levels. And a lot of those are going to be birth outcomes or different kinds of cancer risks. So I think that's a good place to start.
Also, Crystal, if I may add something here,
Yeah.
I think that it's important for the agricultural sector to think ahead. There is a growing demand by society as a whole to understand how the food is being produced and what the associated environmental impact is. That trend is there, and it's only going to go bigger, which is good because can also give the agricultural sector an opportunity to also tell their story, but also be objective, say as I said at the beginning, the trajectory may be good. There are still things to improve. Let's work together to try to solve those issues. So I think that is for the sake of our sector that we start thinking about how we can quantify, how we can be accountable, for the way we produce food. And there are indeed some very interesting initiatives in the private sector doing this, like for example, field to market, where they're trying to quantify, different metrics all the way from yield to nutrient use efficiency, biodiversity, to give end users an idea about what's the environmental footprint associated with the food their farmers are producing. So there are already initiatives going on in trying, to quantify better, the performance of agricultural systems and translate that to end users in a simplified way.
Very good. Thank you all. Well, we've got a couple more questions here. I know we're getting close to the end. If we don't quite get through all of them, we'll try to follow up with some of those responses afterwards. So the next question is, how do you each suggest we communicate the return on investment in regards to fertilizer use to producers? So probably starting with Patricio on that question.
So please, can you repeat the
Sure. It's how do we communicate the return on investment in regards to fertilizer use to producers?
Okay, well, the usual way we farmers think about is how many bushels of corn they get per pound of nitrogen, which is, I would say, okay, but that metric by itself is a little bit incomplete. And one of the metrics I have been trying to push for lately is the use of a very simplified nitrogen balance, in which you basically quantify the difference between the nitrogen input from fertilizer versus the amount of nitrogen that is removed from the field with grain. If the nitrogen balance is greater than about 70 pounds per acre, that means that you're applying too much nitrogen in relation to the yield that you are getting. If you are between 0 and 70, that means that you are within the safe zones. If you are below 0, that means that you are applying too little fertilizer, you're probably mining the soil. So I will say that there is a lot to do there when it's about trying to come up with better metrics to quantify the return to fertilizer, which is not only just yield versus fertilizer, but also account for the balance. And by talking about the balance, you indirectly talk about environmental impact. So I believe that the end balance is a nice metric because you may be talking to farmers about, fertilizer and things, and also money without necessarily, talking directly about, environmental impact, which sometimes it could be, the end of the conversation.
And I was gonna, Patricia, I was interested in a question because as an environmental NGO in Wisconsin, we know that our voice isn't influential amongst farmers. We could point to studies, we could talk to them, but our understanding is that we're not a trusted voice amongst the farmers themselves. I was wondering, Patricia, is there much communication between farmers installing practices and communicating, what they're finding amongst each other, and is that driving any sort of change?
I guess that's a question for me, right? Yeah, okay, good. Okay, first of all, let me know that, because yeah, it's true that farmers are not necessarily excited when they hear, that an NGO is saying something about, but having said that, during the past 5 years, I have been working with EDF on this project on nitrogen balance. And I think it was a fantastic opportunity, to be engaged in a project that will include agronomists, farmers, NGOs, and we purposely, push for this metric of nitrogen balance because we thought that it's a metric that, includes the productivity side, the environmental side, but, without talking directly about those things can help to put people that otherwise won't sit on the same table to talk about something in common, sorry, if I understood correctly, your question was about how good the farmers are at communicating.
Like if someone's adopting something, is there a communication say, we've increased our efficiency, and does that word of mouth, is that an effective way to spread, to this question about how do you communicate the benefits of becoming more efficient? Is there a lot of word of mouth spreading, and folks on the head of the curve trying it out and communicating what they find?
All right, well, I would say farmers are very good in doing that, because otherwise they will run out of business if they don't compete to each other and they try to find ways to be more efficient. But I think there are very interesting things that are also being done at the level of extension. For example, here in Nebraska, there is a project called TAPS, in which they're trying to show farmers that it's not necessarily about getting the highest yields, but also be very efficient in the use of resources. And that has helped a lot of farmers to open their eyes and to realize that making more profit doesn't necessarily mean to produce the highest yields, but rather having the greatest return to your investment on inputs, which also leads to lower environmental footprint. Now, having said that, something that I think that there is still much work to be done by farmers is about translating, I mean, to let their voice be here at a much higher level through their commodity bonds. I think that there is more work that they should be done in making the case that, many farmers are doing well, the trajectory looks good, but there are also things, for improvement, and let's talk about those things. And I think that the agricultural sector needs to do a better job on that. Otherwise, just by remaining silent, I don't think they're benefiting that much. They should start telling their own story and start to talk about how they are going to work together with other disciplines in trying to solve all the issues that we discussed today.
Well, thank you all very much. We've hit 10 a.m. our local time, and this was a wonderful discussion. I hope to continue thinking about how we can better communicate the full costs and benefits of nitrogen, as well as many other products that are out there. So with that, thank you all very much. Those of you listening, I hope you'll stay tuned for our next session. We're going to look at a specific part of Nebraska where some of these practices are being implemented, and learn a little bit more about how we're trying to work on the ground level on nitrogen.